Good afternoon, everyone. We're going to wait about 30 seconds or so, and then we'll get started. All right, we'll go ahead and get started. Welcome to the Health and Environmental Stewardship session, or HES for short. My name is Mela Flom, and I'm the Digital Media Specialist here at the Murdoch Trust. I'm joined today by Jill Lemke, Vice President for Grants Management and Training, who leads the HES area, and Kim Newman, Senior Program Officer for HES. So just a few quick announcements. To turn on live captioning, go to the top of your screen, click the three dots near More, then Language and Speech, and Show Live Captions. Today's session covers funding priorities and eligibility guidelines for strategic project grants within HES as of March 2026. Our intent with this session is to help you assess fit ahead of our upcoming LOI submission window, and we'll cover strategic projects only. So that includes capital, equipment and technology, and program and staff. If you haven't watched our general grant making updates webinar from March 2nd yet, we highly encourage you to check it out. Our Chief Program and Impact Officer, Pauline Fong, walks through general eligibility updates and shares really important context on why we're focusing our funding priorities and why we're doing these webinars. Just a bit of background. In our last submission window, we received more than triple our historic average number of LOIs. And unfortunately, the quality and volume of applications we received exceeds what our funding capacity can support. We are also working to share some resources and tools that can be useful to a broad range of nonprofits. So we will include those resources as well as the general grant making recording in a follow-up email after today's session. So here is the agenda. Jill and Kim will present on HES priorities. We'll address pre-submitted FAQs, and then we'll open it up for live Q&A. So please feel free to submit your questions in the Q&A box throughout this session. And with that, Jill, I will turn it over to you.
Great. Thank you, May. And welcome to everyone. We're really glad you're here. And before we dive in, I want to take a moment to genuinely thank you for the board members, volunteers, staff, and executive directors or CEOs on this call. What you do matters deeply. You show up every day for the people and places others often overlook. You carry hard work with grace, and you pour yourself into building communities where people can truly flourish. This is no small thing. So from all of us at the Murdoch Trust, thank you. We are honored to play even a small part in the work that you are doing. So before we dive into eligibility, I want to give us a brief overview of the HES focus area. This is one of 5 focus areas at the Trust that connects to our mission to build capacity in nonprofits, driving innovative and sustainable outcomes across the Pacific Northwest, and for our vision of human flourishing for the common good. As with other areas of focus, we fund projects in health and environmental stewardship because our benefactor, Jack Murdoch, believed in this work. Jack was an outdoorsman who loved the Pacific Northwest region, and he knew the connection between health of the land we live on and the health of our mind and our bodies, and how critical all 3 are for flourishing communities. So we have 3 aspirations in this focus area: healthy individuals, families, and communities, health and well-being for the whole person. Healthy people and sustainable lands coexist in a mutually beneficial ecosystem. A quick note that while we will be sharing specific additional eligibility for HES organizations, all general eligibility requirements still apply. So make sure you visit those on our website. And then before we go any further, I want to clarify a little bit of terminology around eligibility. The first set of points here refers to current eligibility guidelines. While we don't have an example of all three of these in HES, you will see these terms as you review our full eligibility guidelines or review other areas of focus. So first one is on pause. This means that these types of projects or organizations are temporarily on hold while we do further research and refine our strategy. The next is deprioritized. This means these are not actively funded at this time. And then ineligible means these organizations or projects are not eligible for funding. The second set of points is a summary of how we break down our focus areas. We share this simply as reference so you know how we organize things on the back end and so you can understand the language we use throughout this presentation. So first is focus area, and this is a term that refers to the 5 broad areas where the trust makes investments. And for example, our health and environmental stewardship, artistic and cultural expression, scientific research, and others. A sector is a category within a focus area, such as for us, it's healthy people, healthy minds, or healthy ecosystems. And then within those sectors are subsectors, which is a more specific category within that sector that's typically aligned with commonly recognized language, such as hospitals and clinics, mental health, and wildlife protection. Okay, so Kim's going to start us as we get into the specifics of the HES area.
So starting with healthcare. The trust funds capital projects and revenue-generating equipment, and examples include things like emergency rooms, surgical suites, and diagnostic equipment. For hospitals, we fund organizations with fewer than 100 beds and do not fund large metropolitan hospitals. And size matters for grant type eligibility, so pay close attention, please. Hospitals under 25 beds are eligible for equipment and capital requests. Hospitals with 26 to 100 beds are eligible for capital requests only. Federally qualified health clinics and rural health centers are eligible for equipment and capital requests, and free clinics are eligible for all project types. Community-based organizations focused on public health, preventative care, or wellness programming are also eligible for all project types.
Okay, so next we move on to mental health. And this is an area where we've made a significant change, and I want to make sure it's really clear. Currently, only organizations and/or projects that focus on youth mental health and well-being are eligible. We've made this strategic decision based on the current data around the mental health crisis among our young people due to the loneliness epidemic and the impacts of social media. So if your organization serves a broader population, the project itself would need to have a specific youth focus to be eligible at this time. Within that, we prioritize organizations with models grounded in current best practices, wraparound or upstream services, and the accreditations and certifications appropriate for the services they provide.
There are a few additional care and support categories I want to highlight. Organizations working in abuse prevention and healing, for example, organizations that support individuals impacted by domestic violence, child abuse, or human trafficking, are eligible for all strategic project types. Likewise, organizations providing support for people with physical, intellectual, or developmental disabilities are also eligible for all strategic project types. And finally, organizations using equine therapy are eligible if they're serving individuals with disabilities or supporting youth mental health. Across all of these, the Trust only funds organizations with accreditation and certification appropriate to their services. So if your organization is in the process of obtaining those credentials, that's something to keep in mind as you consider your timing.
And lastly, let's shift to our healthy ecosystem sector. One important thing to note up front, for environmental stewardship, capital projects are currently ineligible. Only staff or program expansion or equipment and technology requests are currently eligible. Within natural resource and wildlife protection, we prioritize organizations with a regional reach that take a stewardship and working lands approach. For land trusts specifically, we prioritize those that are accredited, pursuing projects with regional reach and capable of handling complex transactions. And I'll note that we do not fund conservation easement purchases or land acquisition requests. For outdoor engagement, similar to our current mental health focus, only organizations or projects focused on youth programming are currently eligible. And within that sector, for trail organizations, we prioritize groups with regional impact and multiple partnerships.
This list of ineligible entity types have been on our website for quite some time. However, a recent addition to our ineligibility types are disease support organizations. And as we previously mentioned, we have made some specific changes we'd like to highlight or reiterate. So, if you're in mental health or outdoor engagement, only projects that focus on youth are eligible. Disease support organizations, unfortunately, are ineligible at this time. And environmental stewardship applicants, we're interested in funding people and programs or equipment and technology, but not bricks and mortar. That covers eligibility and priority criteria within the HES area. So May, back to you.
Great. Thank you so much, Jill and Kim, for that really informative and helpful presentation. So now let's get to some questions. We've selected and grouped some that came in during registration. So I'll read the question and then Jill and Kim, one or both of you can jump in and answer. So the first one, what is considered revenue generating equipment? And this is regarding eligibility HES 1.2 on our website.
Thanks for that question. Revenue generating equipment refers to diagnostic equipment that brings in net positive patient revenue. Think CT machines, MRIs, mammography, X-ray. These are billable services that help sustain your organization.
Great, very helpful. The second one, do you fund environmental education?
Yes, we consider that as part of our outdoor engagement sector, subsector. And but just as a reminder, as we previously mentioned, currently environmental education projects are only eligible if they have a focus on youth engagement.
Great, very helpful and that helpful reminder as well. What metrics do you use to identify high impact environmental projects?
This is a great question. I'll go ahead and take this one too. At this time, we are currently going through how do we measure impact? How do we evaluate the impact of projects? So at this time, we're currently asking the organizations, how do you measure impact? Because impact is important, but we're asking you how you measure it and how will we know if your grant has been successful in addressing that impact. We will look at scope. Is it a small scope? Is it a regional scope? But at this time, we're looking at you to identify impact.
Okay, thank you, Jill. And the last one here, would wildfire suppression training programs be eligible for funding?
Okay, another good question. Since we use the lens of capacity building for all HES requests, and we don't fund ongoing programs, a training program may not be a good fit. However, there are other areas of focus at the Trust, and this may be a better fit for our education area. So refer to our website for future of work, vocational, and technical program guidelines in the education and leadership development focus area.
Got it. Very helpful. Thank you both. So now we can move on to some live Q&A. So I see we've been receiving some questions throughout the session, but just as a reminder, please feel free to put your question in the Q&A box. And as it says on this slide, if we don't have time to get to your question today, please, feel free to email grants@murdochtrust.org, and a grants team member will get back to you. All right, so this first question, what type of staffing requests are eligible for mental health organizations?
Kim, why don't you do this?
Okay. So as Jill said earlier, we're a capacity building funder. And so we focus on leadership infrastructure, director, manager level positions that strengthen your organization's ability to operate and grow. And we generally don't fund clinical positions like counselors or direct service staff where insurance or Medicaid, Medicare, and reimbursement is available. So if a position can be sustainably funded through reimbursement, trust dollars really aren't needed or a good fit.
Great. Thank you, Kim. We are receiving kind of like a few different questions around the specific age range for youth criteria.
Great question. I would say we haven't necessarily had a cutoff, but how youth are typically defined. So for sure through 18, there's a little wiggle room, especially like when we're looking at the foster system. Youth is often defined as going a little bit older into the early 20s. So I think you tell us how you're defining youth, and we will typically considering a cutoff of about 18, though, 18 years of age.
Great, it's very helpful. Great question here on are after-school programs or summer camps eligible for a youth mental health and well-being ask?
Go ahead, Kim. Do you want to take that?
I was going to say if it's engaging youth and helping their mental health, I mean, it's a specific mental health organization, not just a group that gets kids outside and say this is fun. And yes, that's helpful. So yes, after school programs are eligible as long as their focus is on youth mental health.
Great. Another question kind of around youth. Does the organization need to focus on youth, or could it just be like one of the programs that they offer?
Yeah, so what we say is if it's not the organization, the programs or outcomes of those projects or programs will need to be youth focused. So you can have, you can serve people of all areas, all ages, but the focus of the project needs to be youth.
Great, thank you. Another question here. This one's a little specific, but would you consider funding a solar and battery project on a free and charitable clinic or FQHC?
That one is specific and potentially, particularly for if it were a free clinic and it were going to help them with their long-term sustainability, but I think we would need to talk on that one individually. So would appreciate you contacting grants@murdochtrust.org, and we'd be happy to talk with you more about that.
Great. This is a bit more of a general question, but is there any limit on the number of applications? I guess maybe this is for, LOIs applications, or how many times you can apply.
That is actually a great question. We request that you submit one LOI per cycle. Don't send us 2 or 3 and expect us to decide which is your top priority. Send us your top priority. If your LOI is invited for a full application, the time of the decision determines how often you can return, how quickly you can return. If you were declined at the full application, you would need to wait a year. If you were made a grant, you would wait 3 years from the grant award date. If your LOI is declined, you can submit another LOI in the next cycle, but not for the same project. It will need to be for a different project.
Right, very helpful. Thank you, Jill. Okay, one question that came in is kind of on if there's certain areas of interest to the trust. Would natural climate solutions, so projects that build ecosystem resilience, be of interest to the Murdoch Trust?
So very possibly, again, that is a pretty specific question. And what I would say is we would be looking at it through the lens of what is a capacity building request for your organization. So your programming is one thing, but the type of request, are you asking us for equipment and technology? Are you asking us for staff? So I would say that would be another great one to send the specifics of your request to grants@murdochtrust.org.
Great. Okay, so this great question that just came in on for mental health organizations, would hiring a marketing or communication specialist be applicable for capacity building?
Absolutely. Absolutely. If it's going to increase your reach and also increase your ability to potentially raise more money, it's a lovely capacity building request.
Great. Another one that came in, if you are a national organization with local program activation opportunities, should a national budget be shared or just one local to Washington?
You know, that's a really good question. It just depends on the size of the organization. We often ask for both. If it's a national organization, we will want to know what is the health of the national organization, but then we would also want to know what is the footprint in the Pacific Northwest, because our North Star is capacity building within our region, which is the Pacific Northwest.
Can I add that we like to see for national organizations for the particular project, it needs to have a 50% impact in the Pacific Northwest.
Yes.
That's a great addition.
Yeah.
Another one here, a bit specific, but would a regional organization serving adult veterans with PTSD through facilitated the outdoor experiences and equine therapy be eligible? So maybe this is okay. So a regional organization serving adult veterans with PTSD through outdoor experiences and equine therapy, is that eligible?
Okay, so as a reminder, right now, our focus for mental health and outdoor engagement is for youth.
And it doesn't mean we don't
I know.
appreciate, right, these people, but we've had to focus our resources.
Okay, another great question that came in. We are an FQHC interested in purchasing a few ultrasound machines, but also would need funding for hiring an ultrasound tech. Would we be able to apply for funding for both equipment and staffing in one request?
That's a great question. We actually ask you not to do that, so just come to us for the equipment or the position. With the equipment, though, we do allow you to request training as part of the equipment request. So that could help support that person that you need to hire as well.
Great. Thanks, Kim. Can you please give some examples of capital projects for hospitals that you most commonly fund?
Oh, gosh. Well, even sometimes just a new facility, right? For a critical access hospital and they need a whole new facility, we would help fund that. We do a lot of emergency room expansion requests, renovations of surgical suites, things like that.
Great. Let's see, another good one here. Our client serves victims of domestic violence, including an emergency shelter. Is HES or community, maybe it's the CECS one, the best sector to pursue an LOI?
Okay, so that's a kind of a great layered question. And the first thing is you don't necessarily have to know where your organization fits. If you're not certain, look at the eligibility for both. You can also email us at grants@ if you have a specific question about an eligibility guideline. But at this time, the organizations that serve victims of abuse, domestic abuse, trafficking, or child abuse all fit within HES.
Very helpful. A great question here kind of on what would make a smaller grassroots organization more or less competitive?
Well, I will say what we typically look at. Grassroots can be we just got started or we've been grassrooting for quite a while. So what we're going to be looking at are we would ask for at least 3 years, 3 to 5 years of both operating and financial history. So we actually go to Candid and pull your financial history as part of our analysis. So that's something that we're going to look for. How long have you been doing the things that you're doing? We don't typically fund startups, but that's different from grassroots. So we would be looking for more established organizations. Sometimes we take organizations or make a grant for an organization for their first executive director, but they've been around a while, functioning, doing their stuff, running programs with volunteer labor usually. So again, if you have a specific question about your organization, feel free to send us an email.
Great answer. Thank you, Jill. Okay, this one, maybe a more general one, but does HES have a cap on LOIs for the next cycle?
Not specifically for HES. We have this is a new thing we're trying this cycle, and that is capping at 300 LOIs for all sectors. And those are eligible LOIs that come in. And yeah, so 300 for all sectors.
And if you're if for the person who asked this question, if you're interested in hearing a little bit more about Pauline Fong, our Chief Program and Impact Officer, talk about this and the reasoning behind it, that's in the general session, which will be linked in the follow-up email after today's session. Just have time for, let's see, a few more questions. This one question, are matching funds required?
Okay, go ahead, Kim. I see your mouth moving.
Okay, I mean, we always want to see community support no matter what the project is. And so we wouldn't necessarily call it matching funds, but so if you come to us for equipment or for capital, is we want to see some sort of kind of leg in the game, showing that the community is supportive and the board is supportive of this project, but we don't necessarily call it matching funds. And then for position requests, we just like to see that you have kind of mapped out your plan in sustaining the position after a trust grant. So again, we don't call it matching funds, but we'd like to see how you're going to provide for that position and carry on that position after the 3-year grant.
One quick thing I would add to that is it is, except for staffing requests, it's rare that the trust ever makes a grant for more than half of a total project. So this is covered in our general eligibility guidelines. So if you've not familiarized yourself with those, that would be a great next step.
Great, thank you both. I think we'll end just with this clarifying question, just because we got a few questions about it. But Jill, can you please clarify just 300 LOIs like per area or all together?
Right.
Yeah, we just got a few questions coming in about
That's
that.
fine. I totally get it because this is very new and it makes sense that there would be a lot of questions. And so what I'll say is, so for example, we received almost 700 LOIs in our last cycle. So what we're saying is we're going to try this cycle, capping it for 300 across all sectors together, a total cumulative number of 300. But that's 300 eligible. So we'll quickly get in, and if it's not eligible based on our basic eligibility, we'll kick it out, and that doesn't count to the 300 cap. But what we're trying to do is focus on 300 that will be divided out among our 5 areas.
Great, thank you so much for that. Just extra clarification.
It's great.
So we are really nearing the end of our time today. So if you have a question that we didn't get to, or if you think of a question like later today or tomorrow, please reach out to grants@murdochtrust.org, and a grants team member will get back to you. So just a few things before we wrap up. You'll receive a follow-up email later today with a link to this recording, as well as the general grant making session, and a list of resources, as well as a 2-minute survey. We really encourage you to complete that survey. Your feedback really helps us improve these sessions and make sure that we're providing information in a helpful way. So thank you again so much, everyone, for joining us. And thank you so much for the ways that you support our Pacific Northwest region.
Thank you.
Bye.